ASP needles. And he asked Bob if he can get up out of the gurney, and Bob's probably not. So he puts 1 or 2 in, and Bob gets up and he walks him out the hall, which we can't see. And about 2 or 3 minutes later, Richard goes, "You want to come in and see this?" So at this point, Bob is now walking up and down the hallway. He's like, "Oh, Richard, thank you so much. I have to go to work." And down the hall he runs. I'm thinking, like 5 minutes ago, this guy was laying in a gurney, screaming. Now he just ran down the hall, yelling, "Thank you, Richard. I'll call you later." And I thought, what the hell just happened here? I'm like, this is crazy. So Richard comes to us and he goes, "Please, don't call me Dr. Neemsel. We're colleagues. Call me Richard." And he said, "Do you guys mind coming with me?" He goes, "I really need to get some coffee." And I was like, "I'll take that. I don't drink coffee," but I thought whatever he just drank, whatever that was, there was some sort of crazy ability. So all morning long, these people would come in and he'd be putting these needles in the ear and their pain would be going away. And you'd ask him a serious question. He'd be like, "How many kids you have?" And you're like, "Well, what'd you just do? What's your favorite color?" And I just never got him. I thought, this guy is putting these needles in these people, and they're walking up and down the hall, and their pain is going away. And as he's doing, he's like, "So what do you do in your practice? You guys get this type of results, don't you?" I'm looking at him like, "No. What do you?" 24 patients he saw that morning, and out of those 24 patients, and these are some bad patients, these are people who failed Western medicine therapies that they had nothing else more to do with. They sent them to the Air Force clinic. And out of those 24, all 24 of them were success cases. When I mean success cases, they all had very limited pain or to no pain at all. And I thought, that's very interesting. That is amazing. So one of the biggest mistakes he made was he said, "Anytime you want to come back down," I'm like, "Well, feel free to come back and see me." Well, Richard didn't realize I'm retired military, so I have a military ID, so I can come and go when I want. So I didn't have to tell him. So for 5 years, I would come and see him. And one time I went down there right afterwards. He said, "John, can you go in the closet and get me some towels and stuff?" And I said, "Sure." So I go over to there and I open the closet door up, and I kid you not, crutches, wheelchairs, canes, walkers came crashing down. And I said, "Richard, what is this stuff?" And he said, and you got to mean, he's like, I treat these people and they just leave it. They just leave this stuff. He goes, "I'm thinking about melting it down." Because I called medical supply up and they said, "We can't keep it because it has different codes. It's not our stuff." He goes, I'm really thinking about melting it down." And he was serious. Yeah, that's right. And you know Richard, right? And I do his medicine really well too. And he's just like, "Yeah, John, we just got to do something with this." He's like, "Maybe we can make some sort of Eiffel Tower or something." He's Richard Neemsel. But I remember that day asking him, saying, "May I have some of your ASP needles to bring back to my clinic, which is right across the street, to see if I can get the same thing?" And he said, "Sure, you know my points." I said, "Richard, I watch you like a hawk all day, no problem." I go back and I have a patient, I'll just call her Gail. And I told Gail this whole story, and at this point I'm like, blah, 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 blah. I'm going to explain this because it's fresh in my mind. And I was articulating what I saw. And as I was waiting for Gail to come in, I'm actually on Google Images and Google Maps. And I swear I'm looking for ley lines that run through Andrews Air Force Base because I'm thinking there's no way that this guy saw 24 pain patients who were severely sick, injured, getting this type of results. I thought there's no way. So I explained this to Gail, and I'm just, I'm talking a mile a minute. And one of the things I forgot was to ask her in between each time I placed a needle and have her walk where the pain was. Now, Gail was a patient I saw a few times that liked to play tennis, and every time she would torque her knees back and forth, she'd have pain. And her pain was an 8, and I'd always get it down to about a 4 or 5, and it would last for a couple of days. And probably about the 4th or 5th needle, I said, "Oh, I forgot to ask you, Gail." I said, "What's your pain level?" And she said, "John, I haven't had pain since the 2nd needle. It's gone. Where did it go?" I thought, it's your pain. Why are you asking me? But that was my first experience with the battlefield acupuncture, and it blew me away. It totally floored me. I was like, whoa. And I tell you this story because in some cases, in just a few hours, that's going to be your experience. That's going to be your history. And I don't want you to be unprepared like I was, because I was just, I was a wreck. I was just like, oh my God, what the heck is this? And I'd ask Richard how it worked, and he'd be like, I put these needles in and the pain goes away, And at the time, he really didn't have a good idea, so if any of you guys know Richard, he likes to joke. He's always joking about something, he calls himself the kid, so go figure. But anyway, that was my first experience at the battlefield, and to be quite honest with you, in the beginning we thought maybe this was like an energetic aspirin, like we were just taking away someone's pain. We were just kind of masking the pain, and it was kind of like giving them like an Oxycontin, and the problem's still there. But over time, we started to see that it has the same effect as regular acupuncture. It has that step-down effect. Like, you'll come back in, the pain might be an 8. After a few treatments, the highest it might go is a 5. But we really didn't know how it was working until recently. Actually, in January of this year, there was a study published, and Earl, maybe you know about it. It was out in the University of Vienna in Austria, where a doctor did an fMRI research, and they showed the intake of oxygen into certain areas of the brain that actually causes the hormones and chemicals to kind of release and causes kind of like a cascade healing effect. So it's new research out there. And over time, I came up with the battlefield acupuncture is nothing more than a simple mathematical formula. It's pretty simple, and we're going to get to that. And actually, it's so simple that I'm going to tell you what it is, and you guys are going to be like, oh yeah, that's what it is. So let's start in with the battlefield. Let's get right into this, okay? So just to let you guys know, the gentleman in the middle of the second picture, which I find one.
John,
yes,
your
ma'am.
black line disappeared.
My black line disappeared. It did. It disappeared. I saw that. This is Dr. Niemsel right here. He's the inventor of the battlefield acupuncture protocol. Like I said, he usually stops by, but he has a lot on his hands these days with his two-week-old baby. So I spoke with him last night. He said, "Wish you guys hello," and sorry you couldn't be there. He's probably still up. The man next to him is Dr. Burns. That is Richard's right-hand man, and he's a minder at the Air Force Base. And Dr. Terry Olson on the bottom, and myself and Dr. Niemsel. That was some time ago in Baltimore, about 5 or 6 years ago. So that's what Dr. Niemsel looks like. So some of the objectives we're going to talk about the history of the battlefield. How did it come about? The first patient. How did Dr. Niemsel even came up with the idea of this battlefield acupuncture? I'm going to show you how to use it and properly implement it into your clinic. Depends on what kind of clinic you have. The most important thing with the battlefield is the needles. You guys, have you guys seen these needles? They're called ASPs. Well, they're French. They're from a company called Salitelic, and the A stands for aiguille, which is needle, semi-permanent. That's what ASP stands for. And we're going to get into the different types of different semi-permanent needles out there. How you can apply this in your practice very successfully. There's certain people you won't want to do this with, and I'll explain to you who those patients are, okay? And there's some patients that, if anybody here treat runners? Yeah, don't do it. They're the worst patients in the world. They're the worst. You tell them not to do something, right? They're right out there. Matter of fact, the guy's gonna swear to you he ain't gonna run. He shows up your clinic with a pair of running shoes. And where's your car? Oh, I parked down the street. Yeah, liar. And there's some side effects. Some of the side effects we're going to talk about in the battlefield. One of the side effects is called delayed reaction. We're going to get into all that because you'll see delayed reactions and stuff like that. Okay? So by the time you leave here, you're going to be well versed in battlefield acupuncture. You're going to be able to apply it like you never saw before. Like I said, we're going to talk about a little introduction. What you can use the battlefield for. There's some conditions that I would say to use it for, and there's some I'd say probably you want to try something else. But it's pretty good for anything. The type of needles out there. Matter of fact, the type of needles, I believe the needles have something to do with how well this treatment works. And Dr. Niemsel himself in the past said he thinks it's about 90% of the treatment comes from these needles. And I'll explain to you why and stuff like that. Proper insertion techniques, the points and functions, clinical cutoffs and the delayed reaction like I was talking about, there's some of that. I'm going to give you guys what's called an ear care sheet that you're going to bring to your clinic and give to your patients, because after you get these patients down to where they have no pain, have you guys ever seen the cartoon Charlie Brown or Snoopy? Well, if you ever watch that, you ever hear them on the phone, they're like wah, 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 wah. That's what you sound like to these patients. They don't hear you. They don't understand you. And you give them a form to take home with them, and I kid you not, this woman said, well, you gave me the form, but I have my convertible down and went flying out, and I forgot what you said. So we're going to explain to you what you do with those type of people, and especially with runners, they can't put in their pants, so they can't run home with it. Okay. So let's get right into the battlefield acupuncture part. Let's talk about how it came about. I was always very interested in finding out how Dr. Niemzel came up with this idea, because like I said, he's a practical joker, and if you ask him a serious question, you're not going to get a serious answer. You're really not. You just that's who he is. So I finally pinned him down one day and I said, Richard, how did you come up with this idea of the battlefield? He goes, well, from 1994 to about 1999, I did acupuncture, and I found 3 points I really liked in the ear. They were omega-2, Schimmon, and point 0. He goes, that was my treatment for everything. He goes, if you had stomach pain, you got that. You had back pain, you got that. You wanted to get pregnant, you got that. If I want you out of my clinic quick, you got that. He said, I just love those points. They seem to work for me. He said, then right around 2000, I went to France. Dr. Niemzel went to medical school in France, in Marseille. And he goes, when I was there, they introduced me to these needles called ASPs, which I thought were kind of neat. When he came back to the United States, he went to the University of California to see Dr. Olson and Z.H. Chu. He's the founder of the PET scan machine. And as he walked in, they were going over some sort of research, and he said, you know, when you have pain, the thalamus is the first part of the brain that lights up. And that's where it goes, and from there it distributes out across the brain. So Richard said to Terry Olson, he goes, well, what happens if you put a needle in the thalamus point on the ear? And Terry goes, well, I'm not an acupuncturist, I don't know. So Richard goes, that's interesting, try it. So he had his 3 major points he liked, and now he learned about the thalamus, and the other point they told him was called the singular gyrus. So he has now his 5 points, he has these new needles, and he has his first patient who had chronic fatigue, or fibromyalgia actually. And he told me that he treated this woman for a number of years, and he didn't get really good results with her, and sure enough, within the first treatment, you know, she was almost healed, he said. It was incredible. So he goes, I knew it was onto something, but he didn't really know exactly what. And over the course of the next 2 and 3 and 4 years, he really honed the technique down. So that's where it came from. It wasn't just a one day he came up with this. It was a course of a number of years that he just built it on things. And when you guys know, if you know Richard, it seems like his life is nothing more than a mystery. Like he stumbles onto something. You know, he talks about, yeah, when I was growing up, I worked. Yeah, I was a test tube washer. Well, you guys heard of the Framingham study up in Harvard? Well, they use his blood as the control, one of the controls. So he'll say, oh, I just was washing test tubes for some famous doctor, I forget his name, you know, blah, blah, blah. But, you know, before he even became an acupuncturist, he invented a technique for counting cancer cells. And his research, they took it, and the guy who took it and furthered it won the Nobel Peace Prize. You know, that's just the story of his life. He's just, you know, he's one mystery after another. And like I said, he's a practical joker. So if you ask him a question, you're not going to find out. So that's what I was explaining about that, how he came upon this in 3 steps. And he used it in the military setting. He said to the military, he said, at San Diego, give me all your patients who have failed. I want to treat them with my new technique, and let me try it. And he treated thousands of patients with this technique, and he's gotten very good success and very good results. Now, some people talk about the placebo effect and stuff like that, and there's a physician in the back who will tell you that he uses it for post-op, and when the people come out of surgery, they need very little drugs, if any. So it doesn't really expand on that. So let's talk about what it's used for. What I use it for and what they use it for. It's good for pain. any type of pain. But be very careful with this if you're not a physician. For all of you who are not physicians, you probably get patients who come to you and they'll say, you know, I have this pain. Well, have you been to a doctor? Why? They're going to tell them, give me some drugs. Be very careful with those patients because this protocol is so strong that it could be masking something. You can be taking away someone's pain. You're taking away that symptom that really that they need to see a physician for. So if they haven't seen a physician, they haven't been properly checked out, don't treat them. If they said, oh yeah, I went to the doctor, I have stomach pain, what do you say? Idiopathic, you know, I went to this physician, I went that. They bring a big stack of medical records. That's your ideal patient because they're compliant, they've been checked out, and you know, you can actually treat them with no side effects that's probably going to harm them. Because if you take away that pain sensory, they're going to say, oh, I don't need to go to a doctor. And meanwhile, they might have something serious, okay? So be very careful with that. As you see, ambulatory care and emergency room treatments, they're actually using this in the ER in some places. I can tell you, right now, probably in Afghanistan or somewhere in the war effort, someone is probably getting this treatment right now. And like I told you about Bob and the stretcher, so they used it on him. So you know, he should have been in the ER. You can use it for anybody with strains or sprains or ankles and stuff like that. They went to the doctor, they said, you know, they gave an x-ray and they said, it's just a sprain. There's no break there, perfect. This will help take away the pain. It'll actually help them speed up their healing process faster too. Any type of back pain, ankle pain. It's really good for headaches, migraine headaches. We're going to get into that later on. You can take away someone's migraine headache like that. If you guys saw, there's something called an endpoint. I put it on YouTube. It's Dr. Neemzo. He came up with this one point in the scalp. I mean, so when you put it in the scalp and someone has a headache, you just stand behind them. Is it gone? Yeah. I mean, it's that quick, and it doesn't come back. And then we'll follow it up with some ear acupuncture with the ASP needles. Pre-op and post-op, I get a lot of pre-op patients that will come into my clinic, and I'll say, the day before you come in, just come in and I'll treat you and stuff like that. Like I was telling Earl in the back, I had a patient who once said, I'm just going in for like a, you know, like a little, you know, kind of procedure. And it made it sound like she was just going to be in and out, but it turns out she was going in for something they had to do an MRI. And I gave her the gold needles, and it turns out they had to pull them out. So if anybody comes in and if they can't tell me exactly what they're coming in for, they're going to get titanium needles because titanium is non-magnetic. So if they have to run them through an MRI or CAT scan, I don't have to worry about them, you know, me getting a bill for like $2 million for them, one of the two. And it's used for when pain management on the battlefield and you can't use narcotics. I can tell you, I'm retired military. When I was on the battlefield fighting wars many years ago,